If you have loose teeth, you should take this very seriously. Otherwise, you may lose those teeth unnecessarily after a while. There are various reasons why teeth become loose. Due to periodontal gum diseases. After dental injuries. Orthodontics, after the use of braces. Due to periodontal gum disease. If one or more of your teeth are loose due to gum disease, it is important to have a detailed examination by a dentist. There are many treatments available that can save your teeth, even if they are very loose. Your dentist will first take several X-rays and measure the depth between the tooth and gums with a special tool. This special tool measures the distance from the top of the gum to the bottom of the gum pocket at the edge of the tooth. Healthy gum pockets are 2 to 3 millimeters deep. Depths exceeding 3 millimeters indicate the presence of gingivitis, early gum disease, or periodontitis, advanced gum disease resulting in bone loss. Treatment options include a combination of root planing, polishing the root surfaces clean of tartar, chipping, using special materials to hold loose teeth together, and surgery, retracting the gums to reach the root surfaces, reshaping the bone and gums, and placing stitches to heal. Contains. After a dental injury, a punch to the tooth can cause it to loosen. If it still looks good, it will usually harden on its own in a few days or weeks. It is important to know that although a tooth may appear healthy and normal on its own, it may later die due to blockage of the nerve and blood supply. If this happens, you may experience symptoms such as a gum abscess, toothache, darkening of the teeth, or no symptoms at all. Our recommendation is that if you have a loose tooth caused by an injury, you should see a dentist immediately. The tooth should be checked for a year or more to ensure that it is healthy and has a solid nerve and blood supply. Orthodontics, after the use of braces. It is common for some teeth to become slightly loose during or after using braces. In response to the pressure exerted by the braces, bone on one side of each tooth is removed and another bone is placed on the other side. This process allows the teeth to move along the bone. There may be a noticeable loosening of the teeth until all the bone is put back into place. This is normal for the treatment process. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.